Hey, welcome back. We're joined in our booth by actress Gloria Loring. Hey, thanks for coming down.
Hi there.
It's great to see you.
My pleasure. My pleasure.
And she's an accomplished author. Your first book was Parenting the Child.
I accomplished 4 books, but I'm not sure if I'm an accomplished author. Well, my first book was Parenting a Diabetic Child, or Child with Diabetes, now, what they call it. And then this is the new one. And I was telling you, I wrote it with Dr. Tim Gray, who's up in Oregon. And what he was trying to do is develop a patient guide that would be friendly and accessible with really good information, but that would also inspire his patients, because he's a general practitioner who has started to specialize in diabetes because there's so many people who have diabetes up in his area. And so we got together with his stories, his information. We pulled in from, of course, a lot of other expert sources, interviewed people. I used my interviews from the Diabetes Wellness Letter, my son's experience, my experience of writing other books, and we put it all together. And most of all, I wanted people with type 2. I think one of the things I've heard through the years of people with type 2 is they'll say, no, I don't. I test twice a week, and my doctor gives me some pills and I'm fine. And then I've also interviewed people who have gone blind or lost their kidneys or lost a leg and said, well, if anybody had just told me that this could happen, I would have done it differently. And that's always very poignant for me to hear because of my son's diabetes. I just thought maybe people with type 2, we always think type 2 is like the easier form, and yet I think type 2 percentage-wise probably accounts for as many or more of the complications. And I think it's because so many people with type 2 think, oh, I'll take my pills and that's enough.
I'm nodding with sadness because my partner's mother passed away of type 2.
Yes.
She was only 60.
Yeah.
And she said the exact same thing.
If someone had just told me it could be this bad.
I didn't think it was this serious, and then she had a stroke.
Yeah, so. And I think that's the thing, there's so many other distractions in life, and we can put off taking care of ourselves. But my theory is always, well, this is my home. This is how I get to stay on this earth and be with my friends and my family and my children and hopefully see grandchildren someday. And so I need to do what I can to take care of myself. One of the things I dealt with in the book is stress. We all talk about stress, but the most important thing in life, and I think it was Thoreau or Emerson said it, what happens to you is not as important as what happens in you.
Right.
And there are ways to have certain things happen in our life, and we don't always have to react to them with such amounts of stress if we have some good tools to use and we know how to use our awareness. I'm doing a talk in Wisconsin for a hospital in November, and we just came up with the title, Diabetes Doesn't Have to Be a Soap Opera. And when we think of a soap opera, we think of people emotionally out of control. And drama. Their life is just, their days are riddled with drama. And diabetes requires and demands a lot of attention. But I have a friend who's had diabetes for 37 years, and he says, I'm still healthy, and I think diabetes has actually been a gift to me because it has demanded that I pay attention to my life. I pay attention to my body. And I think even with my diabetes, I'm actually healthier now as I approach 50 than I would have been without the diabetes, because I started running. I wanted to see my children grow up, and they have. And so he's actually, in a way, kind of grateful for it, which seems like a strange thing. But
well, that's my story, too.
Yeah?
I've been taking insulin 32 years, and knock on wood, I'm healthy. I don't have any complications. And I feel very lucky, though.
Yes.
Because I think some people get the diabetes, and they're more of the free spirit, and it's a disease that kind of demands that you get organized about it.
Right. I think there may be a misconception.
It goes better with some personality types than others.
Yes, for certain. I have a girlfriend who's had it for 41 years now, and no complications at all. And she when she was 9 and she was diagnosed, she said, somebody said, well, if diabetes does certain things to you, you won't be able to go everywhere and do anything. She's a very free spirit, But she said, I don't want anybody ever to tell me no because of my diabetes. So she determined that she would trade off absolute discipline in the area of her diabetes to be able to go everywhere and do everything she wants to do. And here she is 40 years later, and she's still doing it. She has her eyesight, her kidneys. I mean, everything is really good. She's had no complications so far.
That's great.
So I think the message for people is it can be done, but I think the most important thing someone with diabetes needs to know right from the very beginning is that your doctor's not going to do it for you. And there are a couple of things that you need to know, and I talk about them very clearly in the book. And one of them is, even as a person with type 2 diabetes, you must know what your hemoglobin A1C is. Now, the hemoglobin A1C is a test you get taken about every 90 days, about every 3 months. Very important. It shows you what your overall level of control is. You want it to be below 7, actually below 6.5, because the 10-year study we did, the DCCT, and federal study, that they actually stopped before they finished it because the results were so conclusive, is when you keep your A1C, this particular test, below 7.2 at the time, you drop your chances of complication by anywhere from 60 to 72%. And I mean, don't we want to get, the time goes by really fast. You get to your 60s or you get to your 70s and you still want to have your eyesight, and you still want to have your legs and feet, and you still want to have your heart functioning well. I had a mother who didn't take care of herself, even though she didn't have diabetes, but she never exercised. And I looked at her life, and she spent the last 7 years, which was 10% of her life, completely debilitated, at a disabled state, wheelchair, sort of a walker, congestive heart failure, advanced osteoporosis. And when I think of that 10% of her life that she spent in so much discomfort, agony, pain, etc., and I think, wow, 10% of your waking hours, that's 1.8 hours or 1.6 hours a day. We know that even 30 minutes a day of exercise makes an enormous difference. So when you look at the trade-off for 30 minutes a day versus possibly staving off
an hour and a half a day.
6, 7, 8 years of disability, not being able to care for your own home, having to move into a nursing facility, giving up so much of your independence. And don't we want to, as long as we possibly can, have our life be under our own stewardship. And so I looked at that about my mom, and it re-inspired me to take really good care of myself, whether I have diabetes or not. And, nobody's saying it's easy, but it can be done. You've done it. My friends have done it. And the people who've done it and what they have now, they have their health, versus the people like your friend's mom who said, oh my God, I didn't know. I talked to a man named Mike who went blind, and it was too much trouble to test his blood sugar. And too much trouble. Well, I take the pills the doctor gave me. And when I finally interviewed him once he was legally blind, and he said, I didn't realize, I didn't understand that this could happen. And he said, this is from Mike, he said, you tell everybody, please take good care of yourself, because whatever time it takes now is not worth what I'm going through. And it can happen, and it does happen all the time, but we do have choices. And that's
help.
What I try. There's
people
help.
ask for help.
I mean, I'm at a conference filled with incredible information, all kinds of methodologies, strategies, from nutritional to new medications that are coming out, information from exercise physiologists. I mean, there's so many basic things that we can do to take care of ourselves, whether or not we have diabetes. I mean, I do the same thing now that I would do if I didn't have diabetes. I walk, I go and I do some light weight training. I meditate in the mornings. I have some quiet time. People who are faith-based have a prayer time in the morning. If they're part of a church, don't just do it on Sunday. Get up in the morning and make some time for quiet communion with what's inside, what's available to you. There's so many great strategies. And I hope that it's not just to sell books. I don't ever want to talk to anybody again, if I can help, that has had the complications of diabetes and said, oh, nobody ever told me. That's why we wrote this book. You can do it. You can get the support you need. and you can avoid the complications, or at least minimize them. I mean, you may have a tendency toward heart trouble. We've all got our weaknesses, our vulnerabilities. But we know that I think that recently I read that 95% of the diseases in this country are lifestyle associated. The way we live our lives makes an enormous difference. So I'm excited that this is available to people, that people like you are doing what you're doing to get good information. And ultimately, it rests in your hands what you want the quality of your life to be. And you want to look back and go, I'm glad I did it this way, as opposed to, oh, I wish I'd done it differently. And that's a huge thing.
Tell us about Mini Pharmacies.
Mini Pharmacy is a company that we've just gotten together, and Mini Pharmacy ships your supplies directly to you. And there's an 800 number. I suppose you'll have information you can put on the website. Sure. They're terrific. It's a family-owned group, and they're really caring. They're just the nicest people. And I just did a commercial for them to, help people know. I remember sometimes we'd run out of supplies, and we thought we had one more bottle of insulin, and we didn't. And suddenly it's time for the bedtime shot for my son, and it's we have to run down to the Rite Aid, or something. So this way you get your supplies shipped to you. They take care of filling out your Medicare forms and everything, insurance forms, which, believe me, I hate filling out forms. If I had to order supplies, I'd be doing it with them. So they're a great group and good people. So you can go to them, and family owned, and so I'm pleased to be associated, because my whole thing has always been about families that have diabetes in them, and so that's good.
Gloria, thanks for all your work.
Nice to talk to you.
All that you've done to help people with diabetes, and thanks for coming over to talk to us.
Oh, absolutely. This has been
great.
All right, thank you so much. Thank you. All right, bye-bye, everybody.